I want to talk about the hazards of the standard treatment of osteoarthritis, or for short, OA. This is really an important condition because it affects 27 million people in the United States. And on average, 1 out of every 2 people will be affected. How is this disease treated? A mainstay is the non-steroidal anti-inflammatory drugs. They're called the NSAIDs. This group includes ibuprofen, diclofenac, naproxen, aspirin, Celebrex, and there's some others. A study of the deadly side effects of this class of drugs showed that NSAIDs kill 16,500 Americans a year. Now this only includes deaths from the treatment of arthritis and only from GI bleeding, like a bleeding ulcer. Now if we included other deaths that NSAIDs cause, then this number would be much, much higher. NSAIDs can also cause deaths from congestive heart failure, heart attacks, strokes, as well as kidney and liver failure. Studies show that all of the NSAIDs increase the risk of heart attacks. So the number of deaths and injuries from NSAIDs is undoubtedly much, much higher than the 16,500. And this is almost a totally unrecognized risk. Let me ask you, does your doctor tell you any of this before prescribing or recommending an NSAID? Based on this evidence, NSAIDs are probably one of the leading causes of death in this country, and no one seems to care except for this study in 1999 that documented the GI bleed deaths published in the New England Journal of Medicine. Now I have my own theory that NSAID use is a major factor that is fueling the OA epidemic in this country. At the present rate of increase in joint replacement surgeries, now we do 632,000 of these a year already, but if we keep going up, we will soon bankrupt the entire medical care system, considering the increasing costs, the aging population, increasing obesity and arthritis in the population, and the fact that these artificial joints will wear out and require 1 or more revisions. Now, NSAIDs block the production of prostaglandins, which initiate the inflammatory response. The inflammatory response is part of an intelligent design. Now, if we cavalierly block it, there will be negative consequences. In the very first year of medical school, doctors are taught that inflammation is the first stage of healing. So if we block inflammation, then we block healing. Now, many studies have confirmed this. Now, on an X-ray, one of the ways we can tell if there is arthritis is what we call joint space narrowing. The cartilage in the joint is not visible on X-ray, so the space is an indication of healthy cartilage in between. Studies have shown faster progression of joint space narrowing in NSAID users versus controls or placebo. This is the perfect scenario for the orthopedic surgeons. You go in with knee pain, the surgeon prescribes NSAIDs, you're happy because your pain is less. You don't know that this drug may be a leading cause of death. Your blood pressure goes up. This is a documented, consistent side effect of these drugs. So it gets you on another drug for your blood pressure. But that's an entirely different story, and we don't have time for that right now. So let's get back to your knee. So now your knee degenerates faster because the normal healing from day-to-day wear and tear is blocked. Eventually your pain and disability increases, so you have an arthroscopic surgery to clean it all out. Even though study shows that this does no good in the long term, and it actually probably hastens you down the path toward a total knee replacement. Now, another option offered often is a cortisone shot. This also makes the patient happy in the short term. But the knee gets worse from an even more powerful blocker of the inflammatory response. Now, I'm not saying a total knee replacement and these drug side effects aren't good for the economy. But if you follow my advice, there is a good chance you can avoid following the other sheep that are going off the ledge. So what can we do to prevent OA or treat it in its early stages so that we can reverse it. Lifestyle is number one. We want to get control of inflammation and insulin resistance. I cover these topics in other videos. Now, your doctor tells you to lose weight, and that is important, but not because of the weight itself. Animal studies show that loading a joint with extra weight doesn't cause arthritis. It's the inflammation associated with the fat cell that causes the problem. Now, there are mechanical factors that can be important. You should check out faulty biomechanics such as bow-leggedness, knock knees, overpronation. All of these can be addressed by altering activities, adjusting your footwear, adjusting your exercise techniques, or other factors. Now, another key is a natural foods diet. Traditional food straight from nature in conjunction with proper preparation will ensure that your body has the available building blocks to repair your joints. Eating a chemical-laden processed food diet damages your joints just like it damages your brain or your heart. Now, next we want to treat our injuries right. If you have a sprain of your ankle, thumb, knee, pinky finger, whatever, let it inflame and let it heal, and support healing with good nutrition. If nutrition or digestion is compromised, then try some specific vitamin and mineral supplements like vitamin C, magnesium, zinc, and natural inflammatory modulators like enzymes. And these can be taken as supplements. Now, the older you are, the more likely you'll need some supplemental help. Optimizing hormone levels is very important, especially the anabolic sex hormones like testosterone and DHEA, especially if you're older. Avoid NSAID drugs. Try not to immobilize a joint and don't excessively ice it. Prolotherapy is an injection method I use often to treat injuries that don't heal on their own. It strengthens the tissues instead of making them weaker. Now, if this treatment were more widely utilized, it would dramatically reduce the number of joint surgeries and joint replacements that we endure. Now, begin movement and encourage circulation right away. Try to avoid the surgeon. Studies show that one of the biggest risk factors for developing OA is having had surgery. Now, as a resident, I attended these surgeries, and my question back then is the same one I have now. Does removing the tissue from the joint do any good? Isn't it supposed to be there? Their motto, if it's frayed, cut it out. Well, I am for surgery to reconnect completely torn ligaments or tendons or to set unstable fractures. But for most other joint problems, you could try prolotherapy first and you're not going to lose anything. And you would avoid the expense, the risk, and the ultimate arthritis when you have your joint cleaned up surgically. Now, once you have arthritis, a nutrient-dense diet is critical. Ideally, it will contain active enzymes from raw and fermented foods, along with minerals and gelatin from bone broths. A source of vitamin K2 from fermented animal foods is also important. Supplements are better than NSAIDs. Niacinamide, a B vitamin, decreases arthritis pain and improves range of motion. Fish oil, and especially krill oil, will improve arthritis pain and range of motion as well. And you've probably heard of the supplements glucosamine, chondroitin, MSM, and hyaluronic acid. And these supplements have been studied extensively, and they reduce pain and improve function. Now, there's several anti-inflammatory plant compounds that have been tested head-to-head against NSAIDs, and they work just as well without the deadly side effects. Now, it's also really important to keep your muscles strong. Muscle weakness is part of the vicious cycle of joint degeneration. Resistance training is critical to prevent the progression of OA. This is because the muscles are the primary shock absorbers for our joints. If they lose strength, then the joint takes an increasing pounding and it wears through the cartilage. You can do this. It isn't that hard and it isn't rocket science. Instead of using up our resources for more hospitals, training more orthopedic surgeons, and developing better artificial joints, let's put these resources towards something good, like getting our population on a nutrient-dense, natural foods diet. Let's keep active, let's clean up the environment, and let's avoid the damaging drugs and surgeries. Then we'll all be healthier and happier. It's a win-win situation. If you would like more against the grain health advice, please hit the subscribe button above. If you know someone that's going down the path of joint degeneration, forward this video to them. They'll thank you for it. Thanks for watching. This is Dr. Gerhauser.